Welcome to the Therapy Show podcast. I'm your host, Lisa Mustard. In each episode, I interview a seasoned and knowledgeable talk therapist from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. And if you're considering a career in the counseling field or just want to hear about what it's like to be a talk therapist, then this is the podcast for you. More than 427,000 people are diagnosed with Lyme disease in the U.S. each year. This is more than hepatitis C, HIV, colon cancer, and breast cancer, according to the Centers for Disease Control and Prevention. However, it is often inaccurately diagnosed, and many healthcare providers and professionals don't understand the full range of effects nor the impact on patients. It is important for talk therapists to understand not just the physical symptoms, of course, but the mental health symptoms that may present with someone living with Lyme disease. And on this episode, Ruschelle Khanna, LCSW, shares her story as a patient and as a clinician. She wants to help you become a more Lyme-informed talk therapist. And she's going to cover these three objectives on the show today. Identify at least 4 physical symptoms of Lyme disease. Identify mental health symptoms of Lyme disease that may present within your practice, and identify 3 clinical modalities helpful in working with those experiencing Lyme. A little bit about Ruschelle. She is a psychotherapist and hypnotherapist of over 20 years with a specific interest in exploring altered states of consciousness. She is an educator and founder of the A New Therapy Group in New York City, a survivor of neurological Lyme disease. She is also an advocate for mental health within the Lyme community. She now teaches other clinicians to understand and care for those navigating a Lyme diagnosis. And she is the creator of the first Lyme course for mental health clinicians. We hope you enjoy today's episode. Hey, everybody. Welcome to another episode of The Therapy Show. I'm your host, Lisa Mustard, and I have an incredible guest on the show today. Her name is Ruschelle Khanna, and we once again connected over social media. I love how social media brings incredible people into my life, and I'm really, really looking forward to our discussion today on Lyme disease. And this is something, you guys, honestly, I don't know much about at all, but she is the expert, and she is going to share some great learning objectives with us. And I'm going to let her introduce herself and tell everybody who you are.
Hi, Lisa. Thank you so much for having me on the show. I am super grateful for Joe Sandock for kind of his group and him connecting us. So it's just really, really nice to hear you on Joe's podcast. Like you said, my name is Ruschelle Khanna. I'm a psychotherapist of over 20 years in Manhattan, and I have a group therapy practice. I have 4 clinicians, and each clinician specializes in a specific population or modality. One of my specializations is working with Lyme disease because I had Lyme disease. And also all of my clinicians are what we call in the Lyme world, like Lyme literate. So they're educated about Lyme disease and everything that kind of goes in getting better from that or living a life with that illness.
Okay, well, thank you for sharing that with us. I don't know much about Lyme disease, and I know today you're going to definitely educate us on a lot of different areas within Lyme disease. But first, before we jump into that, can you share, how did you decide to become a talk therapist?
Yes. So, I kind of fell into talk therapy. I would say I fell into it. So I went to social work school, and I was planning on being actually someone who worked in policy or more at the macro level. And then coming out of grad school, I knew I just needed to make some money. So I went and got a clinical job, and I wanted to work on getting my clinical license. So I got a clinical job first in substance abuse treatment. And then I realized, oh my God, I love the creative process. I love the flexibility and the aha moments that you get in individual and group practice. And I've just been hooked ever since.
Oh, that's so cool. So you're a social worker, correct? You said?
Yes.
Okay. Yeah. How did you pick social work over professional counseling or marriage and family therapy? I'm just curious to know.
Well, I actually picked social work as an undergrad. I picked it over biology, and I was planning to be pre-med. And then I had a mentor. So I'm a first generation college student. I'm the first generation of my family to graduate from college. So I was a McNair Scholar. McNair Scholars are traditionally, they are for African Americans and first generation college students. So my mentor at that time said, oh no, you definitely want to be a social worker. It's like the coolest thing that you could be doing. So I just listened to John David and was like, okay, maybe I'll try this on. And it's been I think social work is a very diverse degree to have.
That is really interesting to hear you were a McNair Scholar. I love that. I'm sure we could do a whole podcast on McNair Scholars and what what it's like for them to be first generation, college students. Maybe that's an interesting topic. Maybe I'll have to do some digging on that. And I remember when I worked at the College Counseling Center here at University of South Carolina, that was one of the populations that we were encouraged to reach out to and check in with and kind of let them know that we were around because the stressors are very different. Very different. What do you think about that? Would you agree?
Yeah, I mean, I didn't really have my parents really didn't know what to say to me in terms of going off to college. They were just like, you just have to go and do it. We know that much. But there wasn't really much more guidance from my parents around that. So that's why the McNair Scholars Program is important they give you a mentor, you do a thesis in your undergraduate experience. And you get to speak on your topic throughout the country. And get scholarships potentially to graduate schools. So it's a really good supportive program.
That's really cool. That's really neat. Well, thank you for sharing some more about you and how you got to be where you are today. That's interesting. You started out wanting to be in policy and then you needed to make money. So you got into the clinical side of things. It's interesting how we kind of, find our way into the clinical world. And I understand needing to make some money. So, okay, let's talk about the objectives that you have for us today around Lyme disease.
Yes. So I thought we would cover at least 3 things, and then we'll see where the conversation goes. But today I'm going to explain what Lyme disease is and kind of give a definition, but also put it in a political context, in a cultural context as well. I'm going to review the common symptoms and experiences of people with Lyme disease, and then we're going to go over some modalities that have been really helpful to me in terms of working with this population. And then I hope to answer any other questions that might come up for you as well.
Okay, awesome. Let's go. Let's dive into it. Where would you like to start?
Yeah, so I guess I'll start with the statistic and then we can kind of go from there. So according to the Center for Disease Control, annually over 300,000 people will be diagnosed with Lyme disease, and the majority of those will be children. That even the CDC kind of looks at that as a pretty low estimate of how many people are actually diagnosed. And one thing is that diagnosis is very hard, and we can kind of talk a little bit more about that later. But over 300,000 people per year, the epidemic or pandemic, we might call it, of Lyme disease impacts more people than HIV and cancer combined in the United States.
Okay. Wow. So you talked, I know you're going to jump into this, but I'm really curious when you say it's difficult to diagnose. I know that you live with Lyme diseases. Am I saying that correctly? Living with Lyme disease, or you're recovered, or you're, how do I address that correctly?
So that's a topic within the Lyme world as well. Probably what we know from science is that probably the Lyme spirochete. So Lyme is a bacteria. It's a corkscrew-shaped bacteria that is kind of like a cousin to syphilis. So that bacteria probably never fully leaves our body once we've contracted it, much like viruses like Epstein-Barr, things like that really one word could be remission. Some people choose to use the word that they are healed because their symptoms are no longer active, but it's probably not likely that we don't have the Lyme bacteria in our body after we've even recovered. Okay. And so that means that things like additional traumas in the future, physical traumas, car accidents, or stress could possibly trigger a reoccurrence of symptoms.
Okay, gotcha.
Yeah, so diagnosing Lyme this world is changing a lot because over the past 5 years, there has been really an increased interest in Lyme disease, although still like nowhere near where it needs to be. So the traditional tests for Lyme are the ELISA and the Western blot. And one of the reasons why diagnosing Lyme disease is very tricky is because the ELISA and Western blot, they only look at one strain of bacteria, the Burgdorferi strain, Burgdorferi Borrelia strain of Lyme disease. There are hundreds of strains, many strains of this type of spirochete that are unknown. So one is that the test only tests for one specific type of the bacteria. It's estimated that the tests are only about 30 to 40% accurate with that one strain of bacteria. So you can see how there's a lot of room for error there. And then doctors are also kind of taught this language that it's even possible that we can get a false positive. So a person might come back for a positive on a test, and the doctor could deem that it's a false positive and let the person know that actually they don't have Lyme disease. But there's not really a clear justification as to why they would consider it a false positive. So there are other tests that are not standardly used by your local primary care physician. There are tests from companies like Armin Labs is one that we should be familiar with because they're very popular. And IGeneX is another test that's very popular. And I'll kind of write those out and you can have those in the notes as well. There was actually just a test that I just saw an article out about today. So they're trying to get better at diagnosis. Now, the next layer of challenge in diagnosing someone with Lyme is that when we say Lyme disease, because Lyme is a tick-borne illness, ticks generally carry more than one disease. So if a tick bites you, it's possible that you could have any number of what we call co-infections. And those co-infections, some common ones are things like Bartonella. And Bartonella is commonly known as cat scratch fever. Babesia is another common one. Malaria is a malaria-like parasite, blood parasite. So there's Rocky Mountain spotted fever. There's a whole host of other co-infections. So even if the person doesn't test positive for Lyme, is the doctor testing for co-infections, and could the symptoms be related to a Bartonella infection or a Babesia infection rather than the Lyme bacteria itself?
Okay.
So those are just a few of the challenges with diagnosis. And then everything that I just said is fraught with a lot of debate within the medical community. So it's hard for us to agree on how to diagnose.
Sounds like it. I mean, how do you get, you're in New York, I'm in South Carolina. What do you do when you suspect that you might have this? I mean, are most doctors nowadays that in primary care going to, what's your experience from being out there and talking with doctors? Do most of them have enough training to know like they need to send off for more testing or more a specialist? What do you think about that?
I think in the Northeast, it's becoming a lot more prevalent that physicians would at least have Lyme disease somewhat on their radar. That's not a guarantee. There's also a whole segment of physicians who consider themselves Lyme literate and only specialize in working with Lyme and co-infections. In the South, I get a lot of calls from all over the country, and I hear a lot that there's still this idea outside of New England that Lyme disease doesn't exist where I am, when in fact Lyme disease exists all over the world. Right. There's not a place outside of Antarctica that doesn't have Lyme disease where it can't be found. So I think outside of New England, it's a little bit harder to find doctors. And now there are pockets, places like Oregon, California, where there are a bit more Lyme literate doctors. But for our purposes, I'm really trying to get a lot more Lyme literate therapists out there as well.
Okay.
Because we help with diagnosing and getting people to medical care as well.
Yeah. And I know you and I talked about this when we were just kind of connecting and going over some things. You were saying when folks come to therapy for the first time, we rule out medical diagnoses, right? And I'm, like you said, like, I'm not a doctor, you're not a doctor. So how do we do that? We want to send our patients, our clients, to go get a full, checkup with their doctor, of course. But if doctors aren't catching that, what are we looking for, I guess, as therapists? What would be some of the signs or symptoms that would not necessarily fit with what we typically see, I guess?
Yeah.
It's a big question.
So, but I think we do have a place to start. First of all, if you know any of the initial signs and symptoms of Lyme, some of the classic ones that not everyone gets are Bell's palsy. So it may look like the client has had a stroke. So we can look at physical symptoms first. Okay. Bell's palsy, neck pain, muscle, knee or elbow joint swelling, and what's called a bullseye rash. So you're really lucky in the Lyme world if you get a bullseye rash, because most doctors will take you seriously if you have a red dot with a red circle around it. And that can be, small, or I've seen them that are, the size of someone's torso. They have a full red circle and a red dot. So if a client is exhibiting any of those kind of outward physical symptoms, absolutely, they've been bitten by a tick. Absolutely, they need to go to a doctor who knows about Lyme disease and be treated immediately. Okay. Outside of that, if someone didn't have a rash and they are kind of unsure what's happening to them, but they're having bizarre physical symptoms, neurological symptoms, onset of hallucinations or suicidality when it was never there before, when there's just not any other reason why this person would be suicidal or homicidal. If they say things like they're having burning brain pain, burning neurological pain. Another common one is I'm having anxiety that doesn't feel like regular anxiety. They'll say things like, it feels more like a physical anxiety. Tremors, trembling, convulsions, pain in their spine. So again, all of these are physical. Not all of them, but a lot of them are physical. And rather than just looking at, well, maybe this person needs chronic pain management, no, maybe they need to speak with a Lyme literate doctor just to rule out an infection. So that's what we're looking for. When we talk about depression and anxiety, we've all heard in school that we need to rule out thyroid disorders. Mm-hmm. We would immediately send someone for a thyroid panel if they're a middle-aged person and they're having uncontrollable anxiety or depression. That's pretty standard mm-hmm. for a physical. Mm-hmm. So I would like for us to treat these neurological symptoms the same way.
Okay, gotcha. So what would we be wanting our patients to be asking for if we notice these neurological symptoms? Is this where we would ask them to get the different tests that you mentioned earlier, those types of tests?
So we should encourage them to, if they have a relationship with their primary care physician, again, here we come to a fork in the road where there's a bit of a debate. Okay. In the medical community, a lot of people look at Lyme literate doctors as people who over-treat for Lyme disease and just tell everyone who comes through the door that they have Lyme disease because it's nebulous. So we don't want to just be sending people to doctors who that's all that they do. Okay. Because we don't want all of our clients diagnosed with Lyme disease either. Right. So what we're looking for is a thoughtful medical partner that they have who can be open and explore this together. So everything is not Lyme disease, and I don't want to be that person who says everything is.
Right.
I can say it's super common because we're getting 300,000 minimum diagnoses a year.
Mm-hmm.
But we want, does your primary care know about Lyme disease? Are they willing to look at that? Here's some information for you to look at to see if possibly you do have an infection. Would you like to go and talk to a doctor who specializes in Lyme?
Gotcha.
Have you been in the woods lately? Did you see a tick? And so those are just a few of the questions that we can start with when we see someone who has bizarre neurological symptoms, maybe suicidal or homicidal ideation out of nowhere,
Mm-hmm.
weird anxiety, including obsessions and compulsions where they didn't have it before. Yeah.
Okay, that's super helpful. Thank you for sharing all of that. That's really helpful. So have you had the experience where people have presented for therapy and, that's what's going on? I mean, I know that's kind of like what you're interested in and what you specialize in, but I mean, have you had that case where somebody walks in and you're like, oh my gosh, this is it. Like, I think you have Lyme disease.
So I generally, because I advertise as someone who understands Lyme, I generally get people who already have Lyme disease. They know that they have it and they're looking for a therapist who understands.
Gotcha.
But I have had a couple of people who had bizarre physical symptoms who were referred by nutritionists that they needed to be, they either had tick bites when they were with me and then symptoms presented themselves. So it was clearly a tick-borne infection, or we worked together to rule it out. So I would say that's definitely on the, at least for my caseload, that's on the lower end of the spectrum. But I was one of those people. So I was having a laundry list of neurological symptoms and psychiatric symptoms and went to my primary care. He did not believe that anything was wrong. He prescribed me Valium. Mm. And then I went to a psychologist after having been to neurologists, rheumatologists. I did the whole, I've seen 16 doctors, nobody can help me thing. And then I thought, well, maybe it is all in my head. So I went to a psychologist and she affirmed that it was all in my head and I probably just needed to be institutionalized for a while. And I was having a psychotic break, which was what was told to me, and that I needed to just be on antipsychotics and Valium. And I hear other clinicians say that a lot, that they have people who were institutionalized and then later they found out that it was Lyme disease.
Oh gosh. Wow.
So that is a common story that I hear from other practitioners. So they're kind of getting them after they've come out of the inpatient psychiatric experience.
Wow. How did you figure out that you had Lyme disease then?
So actually a Facebook group diagnosed me. So I refused to believe that I was just having a psychiatric break, and I went home and I started to do, my Google searches and kept Googling and Googling and Googling. And it kept coming up with mercury toxicity. So I had a mouthful of mercury amalgams. And I thought, oh my God, my teeth are poisoning me. So I went to the dentist, had my mercury amalgams removed, and I was in a mercury toxicity Facebook group. And so I have my amalgams removed. I have a horrible physical reaction to the removal of the amalgams. My esophagus swelled up. My whole mouth was full of blisters and was raw. But 3 days later, that physical anxiety went away. I had a relief of a psychiatric symptom pretty much immediately. And so but all my other neurological symptoms were still there. So I go on the mercury group and I said, hey guys, I had my teeth removed. I'm still really, really suffering with this and this and this and this. And they said, oh my God, you have Lyme disease. And I didn't even know what Lyme disease was. I never even heard the term. So I started researching Lyme, and I looked for doctors, and then I found a Chinese doctor, a Chinese medicine doctor, and they started treating me on an herbal Lyme disease protocol. So I never took antibiotics. I only took herbals. And within 3 months of starting the herbals, my psychiatric symptoms had abated. And I also broke out in the classic, once I started the herbs, my skin became covered in the Bartonella rash. So when you have Bartonella, you get these, it looks like a cat has scratched you all over. Mm-hmm. And so when you start taking herbals, if there's an infection present, your body might respond as the infection is leaving. And when we treat for Bartonella, those rashes come back out on the skin. I had never seen them before. So the path that I took was that I use Chinese medicine. And in Chinese medicine, if the practitioner, they don't use tests, right? I mean, they might use blood tests as an alternative, but generally they make an assessment based on a host of other things that we in Western medicine don't understand. And then if the treatment resolves the issue, you know that that's the problem that you had because there's a response. Gotcha. Otherwise, herbs are benign. So if you take an herb and you don't get a response, then you didn't have that problem because herbs are just herbs and they're not going to hurt you. Mm-hmm. But if you have a response, a healing response, and we can talk about that, that's called a Herxheimer reaction. A Herxheimer reaction is when you take an antibiotic or an antiviral and you get sicker because the bacteria is dying or the virus is dying, and there's what we call die-off in the system. So you get sicker for a while before you get better.
Okay. This is fascinating to me. I'm just over here like listening. And first of all, your story, I mean, just, wow, you've definitely been through a lot. And I can't even imagine feeling that you were having a psychotic break and that everybody was telling you that that was the case. I mean, that in itself, how would you describe that experience now looking back?
Well, for a while I was angry.
Sure.
But looking back, I really, she just didn't know. Mm-hmm. And I look back at the years that I ran outpatient mental health clinics and all the people there who were so desperately ill, psychiatrically ill, and they all had health problems. They all had uncontrollable diabetes. They had inability to control their temperature. They had issues with sweating. They had heart problems, all of these physical symptoms that went along with their psychiatric illness. And at the time, I knew that it wasn't right. I knew that something was going on with these people that was beyond the need for psychotherapy. So my experience just kind of affirmed that we cannot separate what's happening in our gut, our blood health, the health of our organs from our mental health. We just can't.
Yeah. Okay. Well, thank you for sharing that. That's kind of a personal question, I guess, but I was really curious, like, looking back on that, how did it affect you, when you think about what it was like? And I think that's really fascinating and interesting that being able to use your experience and look back on cases in the place that you worked previously, you're like, oh my gosh, it all makes sense, and I agree. Like, I think it's all connected. I think, we aren't just up here. We aren't just thoughts and feelings. We are definitely we're a system, and it all works together. And okay. Well, thank you for sharing that. I appreciate that so much. Okay. Well, what do you want to dive into next? Like which objective would be helpful to kind of go from there?
So I think the next most important place to start is this idea of suicidality. I think anyone who comes into your office and they say that they have Lyme disease, or you suspect that they have Lyme disease, it's also fair to assume that they are at least passively suicidal. So this population, that we should assess for that immediately. And I know a lot of us in private practice may or may not have just a standard of assessing everyone for suicidality every time they come in the door. I worked in outpatient community mental health, so that was so drilled into me that everybody gets a suicide assessment still in my practice, even if they aren't exhibiting at all.
Right.
But especially with this population, you want to be asking, especially about the passive suicidality, because the nature of the illness comes with, at times, really intrusive thoughts and really violent hallucinations. So especially in infections like Bartonella, so we're talking about a brain infection here. Once Lyme disease has entered the central nervous system, it's living in your brain and spinal cord, and it's causing a reaction much like a traumatic brain injury. So if we start to think of Lyme like a traumatic brain injury, then we can start to look at our patients through that lens. And of course, if someone's been in a horrible car accident, or they're a concussion survivor and they're a football player, we're really taking their safety, and they're developing a safety plan with them into account, because they're suffering so much from the swelling and the inflammation. Mm-hmm. So that is the approach to take with someone who has Lyme. Okay. There's people who have neuropsychiatric Lyme will exhibit encephalitis-like symptoms, even if they haven't been diagnosed with encephalitis. We can assume that there's a lot of brain inflammation happening there, causing rage, agitation. They will at times talk about pain behind the eye. So all of your cranial nerves, you have 6 cranial nerves on either side that are part of your vagus nerve system. The optic nerve is a place where Bartonella loves to live in the fatty tissue. So they'll talk about stabbing eye pain behind the eyes. They'll talk about pressure in the frontal lobe, or a burning, or as if their brain is being squeezed in a vice. So there's this really bizarre kind of unexplained pain that people have a hard time articulating to their clinicians. And what I've found is that if I'm not asking pointedly those questions, like, do you have burning brain pain? They may not share that with me, because they don't know that I even would know what they're talking about.
Right. So you're giving descriptions to their symptoms that they recognize that they have something going on, but they haven't maybe been able to put it into words. So you're giving them the words in a sense. I think that's really neat.
Yeah.
Okay.
So another one that's very common is derealization or depersonalization. I kind of describe it almost like I had this symptom, so I can then articulate it to other people. But if you hear somebody say, or you might ask them, did you feel autistic? Because there's a blunting of emotions that happens. Some people will describe, I can't connect to anybody anymore. I can't love my loved ones. Okay. I'm no longer able to connect to my home, to my animals, to my loved ones. They might describe, I'm looking at my life through as if it's a movie, right? So more classic derealization language, but they also may not know that they can tell you that either. So really assessing for the derealization. They might say something like, I'm in a hopeless depression, or something more general. But then when you really dig a little bit deeper, it's worse than a depression, because I still don't really know how to articulate the inability to connect with the objects around me, except by saying that I had autism. That's the only thing that I know to relate it to.
Yeah.
In terms of a description.
Okay. Well, I understand what you're saying. I mean, I've never, felt that myself, but I can understand what that might feel like based on what we know about autism and what that presents as, and how people describe it and how families describe it, that kind of thing. So that makes sense to me for sure. Thank you. Okay.
Yeah. So really the psychological torture that people can experience is pretty extreme at some points. Another issue that comes up is medical trauma, and that might be a little bit more common outside of the Lyme community, but people who have had traumatic experiences undergoing medical procedures. So when you have Lyme, you might have had a PICC line, much like a port, much like we have when we have cancer. So people who are doing IV antibiotics, they're living with a port or a PICC line. And a lot of times that experience is traumatic for people. So if you've worked with cancer patients or other people who've had that procedure done, that's a similar experience. Attachment disorders are going to come up through this, like being overly attached to the PICC line, being afraid that they're going to get sick if they take it out, yet they're definitely not, they don't need to be on antibiotics anymore, but they're afraid to take their PICC line out. Mm-hmm. Kids especially will see they're afraid to take pills, or they're afraid to get shots. They're afraid to get any more injections because they've been just poked and prodded and had to take thousands of pills over the course of their life. So helping people stabilize with medical trauma is another thing that we should know.
Okay. Now, I imagine that some therapists listening are, okay, well, I can help my patients or my clients with those things just by, just through the relationship of therapy, just by having that therapeutic relationship. However, is there special training out there? Anything specific that we could go and learn more about? A certain type of therapy that you would recommend? Is CBT helpful? What kind of therapy do you find to work well?
Yeah, so with a lot of people who have Lyme, there are a host of other things going on. So there's history of childhood trauma going on. There's possibly recent trauma, loss of income, not from the treatment, but from like losing their job. There's also a pattern of these really toxic relationships that they're in, toxic business partnerships, toxic marriages. So any of your modalities that are helping with boundary setting. So if we're thinking in metaphors, boundary setting kind of models our immune system. So our immune system is a boundary. And when we have immune dysfunction and immune dysregulation, we often see that kind of paralleled in their relationships. So the DBT stuff is great. Setting healthy boundaries is something that I do a lot with people with Lyme, because often they'll say things like, I always overworked. I was the one who gave too much and didn't get anything back. If we think about people who have fibromyalgia, also very common in fibromyalgia, and there's definitely a crossover between some people who have fibromyalgia have Lyme, right, and vice versa. So the DBT is great. Another thing, so when I first became ill, I was having hallucinations. And I find this very common with women who've had history of trauma and now they have Lyme disease. They have these hallucinations of these really scary entities. So I was having one of those, and I just happened to find an osteopath who was also a psychotherapist. And she practiced internal family systems therapy.
Cool.
So the internal family systems therapy helped me resolve the terrorizing hallucinations that were associated with my Lyme disease. And interestingly, I see that story, that same kind of psychic break of having different versions of ourselves who are terrorizing us, has come up in quite a few of my female Lyme clients. So a combination of internal family systems and hypnosis has been extremely helpful in kind of reshaping the relationship of this split. Because in my hallucination, there was a younger girl terrorizing me around my apartment. She was just awful and scary.
Yeah.
And the internal family systems helped me heal that relationship. A, realize that it was a part of myself, and B, repair it.
Yeah.
So to me, and I don't want to overgeneralize, not everybody's Lyme disease experience was like a spiritual awakening. But sometimes it is. Sometimes trauma is a spiritual awakening, that post-traumatic growth syndrome rather than post-traumatic stress. And so I think it's important to be on the lookout for people who want to use their traumatic experiences as a growth experience rather than a trauma. And then if they don't want that, that's okay too.
Okay. Wow. I'm at a loss for words right now. I find this happens to me a good bit on the podcast. I get so, and for those who don't know, like we do these podcasts, I do these podcasts over Zoom. So I'm looking at Ruschelle right now and I'm watching her and I'm seeing her body language. And, I'm just so honored that I get to interview you and hear your story because your story is so powerful and it's going to help so many people. So thank you once again for being here and sharing. I'm just like, I don't have words. So I'm grateful. So if you could shift a little bit and talk to us therapists who, we're like, oh my gosh, I want to learn more. I'd like a deeper dive into this. Where would you recommend that we send them or send us to go check more? I know you have another opportunity for learning. So can you tell us about that too?
Yes. So I actually just launched what seems to be the first continuing education on mental health and Lyme disease. And I partnered with Simple Practice Learning, and we just released that actually within the past week of us recording this. So this was as soon as I got better, I realized that I wanted to educate as many therapists as I could about the fastest growing infectious disease in the country. And it's just so important that every therapist at least be aware, just like we are of HIV, just like we are with cancer, of what these people are going through. This is a marginalized population. This is a population who is not recognized by the medical community in a lot of ways, just like HIV. So you can visit Simple Practice Learning to take a 1.5 credit course where I dive deeper into kind of all of these things that we talked about, a little bit more into the political controversy that is Lyme disease. There's a book called Bitten, if you really are into conspiracy theories turned reality. not such a conspiracy theory anymore about Lyme disease as a bioweapon. And then also organizations like the Global Lyme Alliance is really, really good. A resource that I like to send my clients to also is Lyme Advise. Lyme Advise is a website, so it just has a host of resources that my friend Alyssa, she has Lyme as well. Alyssa has put together a great resource, and that there's a doctor who kind of speaks through Lyme Advise as well, Dr. Bach. He's an expert in this area. So I'm happy to share all of those with you, but definitely check out my CEU and then Global Lyme Alliance, really, really good resources.
Okay, that's really helpful. I know I'm going to backtrack just a little bit and talk some about hypnosis, because I know you're also a clinical hypnotist, correct? That's something that you do. Could you talk some about other issues that you find hypnosis to work really well for?
Oh, wow.
And it's kind of pivoting a little bit, but I feel like we're on this topic and you're so wise, and I want to shift just a tad and have you talk about that if you can.
Sure. Well, on the topic, but also off the topic, co-occurring issues with Lyme disease. So IBS. Hypnosis is great for IBS. Hypnosis is great for pain management. Hypnosis is great for insomnia. A lot of our Lyme clients have horrible insomnia. Hypnosis works wonders for trauma. So all of those things. And then I love hypnosis because the one thing that it does for everybody in all situations is gives us a sense of empowerment. So if people are just looking generally to feel like they have more power and control over their lives, that's where hypnosis is a great place to,
How many sessions do you find is about average for somebody for hypnosis?
It varies, but 6 sessions, 8 sessions, depending on, if we're talking about panic or IBS. The smoking, I don't really do a lot of like smoking cessation, but we can do that 6 to 8 to 12 sessions. The insomnia is around the same or less. I find that it's really when you find clients who are already motivated to do, just are really motivated to do it, it works better. So if somebody comes in saying, I want hypnosis, they're going to get results. And then some of the other clients that I have, they may not know about hypnosis. They may not know it's an option. So we do a little bit of education. And then if it seems interesting to them, then we can kind of slowly integrate it into their sessions.
Okay. Do you do anything else unique in your work? I was just curious as you were sharing that. Like, you're a yoga instructor too, right?
Yep.
Okay.
So I taught yoga. For 15 years. So I live in New York. Yoga classes are big here. I work with a lot of young women, so they're all kind of in the yoga zone. So I use yoga more in terms of in session, kind of philosophy, our breathing work together. And then if they want kind of a prescription for poses, I'll send them home. Like, let's say I have new mommy who's anxious. I'll give her 3 to 5 yoga poses to do before bed or when she's waking up in the morning. So I don't do kind of a yoga flow in a class setting, but we'll do things in the office and then I'll demonstrate poses that they can do at home.
Okay, that's neat. That's an interesting way of using it as a prescription. I never really thought about that, but I guess that would be something like similar to what's your practice like at home when people say they have a yoga practice. I have a good friend here who is a LMFT, and that's something that she does with her clients is she'll do yoga as well. And she says it works great. Like, they love it. So I think that's really unique how we're integrating all these other holistic and body movement into therapy nowadays. We've really, our field is just, there's always something new that we can, add in if we want to help our clients. And like you said in the beginning, the creativity that comes with this field and being able to help people, I love it. I think that's just one of my favorite things about this profession. Is there anything else you want to share about Lyme? I know you briefly mentioned the political and policy issues surrounding the Lyme disease. Is there anything you want to kind of touch on before we end? Because I think that is important for you to share, for us to know about.
Yeah, so I guess just really briefly. So Lyme is political for one reason is because the government owns the patent to the bacteria. So I don't know if our audience is really familiar with the government owning patents to bacteria, but when the patent for the bacteria was established, the diagnosing criteria was very strict. So for a long time, if a person wasn't exhibiting these bullet point of symptoms that are kind of defining Lyme disease as they have defined it, then they didn't have Lyme. So that's really ridiculous and unfair, because Lyme is a blood infection, meaning it can go to any part of the body that is compromised. It can look like anything from multiple sclerosis to migraines. I mean, Lyme can manifest as knee pain or a heart attack. So there's no way that we can classify Lyme into this really small box. And so the argument has been for a long time that why are we doing that? It's ineffective, and it's really discriminating against people who have symptoms that don't match that really small criteria. So that's only one little tiny tidbit. The book Bitten, which is really, really popular and which I haven't read and I'm not going to read because I did enough research back when I first got sick. I can't take it anymore, but I recommend other people read the book Bitten. It talks about the U.S. government's research on Plum Island off of Lyme, Connecticut, and the emergence of bioweapons. And I mean, we know that the United States and other countries dropped bioweapons on innocent civilians unknowingly in other parts, not Lyme, but other parts of the country. I mean, not bacteria, but bioweapons have been dropped in Alaska, over Canada. You know, there's a host of testing that's been done without our knowledge. So the book really dives deep into the role of the government and bioweapons.
Okay. Well, thank you for sharing that. I don't think I'll read that, but maybe I should. I don't know. One of those things like, I don't know if I would go outside again if I read something like that. But what can we, maybe that's a question I should ask. Like, what can we do to protect ourselves from ticks? I mean, what is the protocol? Do you know what it would be?
Yes. Yeah, absolutely. So one chemical that you want to be familiar with is permethrin. Okay. So permethrin used by the U.S. government to coat their clothing. You can buy permethrin coated clothing. I mean, me now, every time I go out into the woods, I'm like fully covered and spraying down with bug spray and geranium water and like crystals. And, I'm not taking any chances. Right. That's another thing, which is people who have Lyme also become paranoid of going outside. Okay. I'm not paranoid of going outside anymore, but I am going to take every precaution possible because Lymes can be in your local park. Ticks can be in your local park. So, permethrin soaked clothing, also wearing bug spray that kills ticks. I'd rather have the toxins from the bug spray than get bitten by a tick. Some other kind of off the grid things are eating copious amounts of garlic before you go on vacations outside. That's kind of like an old traditional Chinese way of dealing with ticks. And then if you do have a tick bite, you're not going to light the tick with a lighter. You're not going to pull it directly out with tweezers. You're going to have a special device there's one called Tick Ease that gently turns the tick and pulls him out, because when we pull the tick with the tweezers, they regurgitate their saliva back into your body and puts the infection, right? Like more into your bloodstream. We also don't want to light ticks on fire. So you're going to take it out correctly. You're going to put it in a bag, and then you're going to send it to your local testing center to have the tick be tested for Lyme and co-infections. Okay. And I can look up some places where you can send the tick. Again, if there's a rash, you go to the ER immediately and be put on antibiotics, because a lot of people's immune systems can just recover from the tick bite. Mm-hmm. So if we're treated on time, a lot of people can just get better and not have kind of long lasting symptoms.
Okay. So that's real helpful to know that if you are bitten, you need to go and immediately get antibiotics, or only if you have a reaction, or what do you?
So most doctors, even most primary care doctors now, would say, if you're bitten, we're going to go ahead and put you on like a 10-day doxycycline or 10 days of some antibiotics.
Okay.
While the tick is being sent off to the lab.
Gotcha. Okay. Good to know. Okay. All right. Is there anything else you want to cover that we haven't covered yet, or you want to go back to and cover some more?
We can talk a little bit about, I don't know. Let's see. We've covered a lot. Look, I can talk a little bit about some of the other symptoms of Lyme that are common. Eating disorders. So this may be interesting for possibly another practitioner, or maybe a second interview with us together. Something that I know a little bit less about, which is PANDAS. So PANDAS is an acronym. Are you familiar with PANDAS?
I think so. I feel like I know I've heard it. I just can't place it right now. So go ahead and share what that is.
So PANDAS is pediatric chronic infections. It's an acronym that really represents pediatric chronic infections that are untreated.
Okay.
So there's an overlap between Lyme disease and PANDAS, especially in symptomatology. With PANDAS, we'll see kids become OCD, anorexic, and agitated. And a host of other things. But those are, if our child becomes OCD out of nowhere, the first thing that we want to look for is an unknown strep infection.
Oh.
So this we also see in Lyme disease. A lot of times people will just exhibit anorexic-like behaviors out of nowhere. And the infection makes us really unable to keep weight on in some people, and it also the infection and the inflammation in the brain can cause that anorexic response, or we're starting to have autoimmune reactions to our food, so allergies to our food, and we naturally become scared of eating. And so clients will say things like, but everything I eat makes me sick. Well, now the toast makes me sick. Well, now the string beans make me sick. Everything's making me sick. And family members will dismiss this as, oh, now you're just being dramatic. Now you just have, now she has an eating disorder. Like, what is happening?
Right.
Well, no, the body's actually having an autoimmune reaction to food, and can have that reaction to most anything.
Wow.
And if Lyme disease is really, really kind of targeting our gut, we'll have a lot of bloating, difficulty digesting food. We're no longer absorbing nutrients anymore. So, the eating disordered and kind of digestive symptoms are something that is an overlap between Lyme and PANDAS. And I'm not a child expert. I'm not a child psychiatric expert. But this is an area that if anyone wants to kind of start a niche working with kids with Lyme disease, please give me a call, because people are always looking for how to help their kids when they have chronic infections and the psychiatric issues that come along with that.
Wow. Yeah, I bet. Do you find that when, well, I guess I can kind of jump to the assumption that there's not a lot of psychological support that is out there with folks that have been diagnosed correctly with Lyme disease. They have to kind of go and find it on their own. Is there like I don't want to say a clearinghouse, but is there a website or a place they can go to get help for, like, no, you're shaking your head.
Not right now. So
Okay.
Lyme Advise started kind of gathering some practitioners. Also, iLab is another international organization that is focused on Lyme disease. I know they're also getting ready to launch a CEU and probably a directory. I mean, they are the national organization for Lyme disease, like Global Lyme Alliance.
Okay.
They haven't done it yet. I get calls from people all the time, and then I just try to find somebody local. What I've done so far is I'm willing to well, now that I have a course, I would probably just say go take the course first. Mm-hmm. But if people need supervision or want to do a consult, sometimes the client or the client's parent has paid for my consult with the local clinician, just to kind of be a mediator and an educator about what's happening. A lot like, there's the kind of rise of competent Black therapists and how to deal with race in the session. Now there are a lot of Black therapists who are kind of helping give consultation to a non-Black therapist, right, to help out when that's coming up. Okay. So I kind of do the same thing for Lyme.
Gotcha. Okay. Well, that is a wonderful, resource and referral right there, is to work with Ruschelle as a consultant. And if some therapists are out there and they would like to maybe do some coaching with you, I guess, or consulting with you, or mentorship, is that an option as well? Like if they could, maybe before they even have a client, can they reach out to you and, I know, take your course for sure, but if they want a deeper dive and learn more about hypnosis or internal family systems, is that something that you do? Okay, she's nodding her head.
Yeah, absolutely, absolutely.
Okay,
yes, cool. Yeah. I love. I mean, I have newer clinicians that I teach every week, but I'm happy to do consultations with you and your already established practices as well.
Okay, awesome. And what is the best way for them to find you?
So you can reach me at anutherapy.com. So ANU therapy.com. That is my group practice. And that's the quickest place to reach me right now.
Okay. And we will definitely link all of this in the show notes. We will have so many resources. I'm so excited to present this information to our peers and to our professional colleagues that are listening today. This has just been, I knew I was going to learn a lot. I knew from our talk when we connected that first time, I remember walking away like, wow, I'm going to be I'm going to be learning just as much as the listeners are. So thank you so much for coming on today and sharing. And is there anything else you want to share before we say bye?
No, I really appreciate this forum. And thank you, Lisa. Love your show. Thank you so much for having me on.
Oh my gosh, you're welcome. I hope to have you back eventually down the road. I think this is really great. Okay, so thank you. Well, that wraps up another episode of The Therapy Show with Lisa Mustard. I know there are hundreds of thousands of podcasts out there, and I'm thankful you've chosen to listen to mine. Be sure to visit lisamustard.com to access the show notes and discover more fantastic content. And I'd be grateful if you subscribe to the show. Thank you.